Let's talk about it. Suicide. It's the second leading cause of death among Maine teenagers, according to Maine DHHS. Thanks for joining us. I'm Chris Costa in for Pat Callahan tonight.
And I'm Amanda Hill in for Cindy Williams. The CDC is awarding $850,000 to Maine to improve its suicide prevention programs. News Center Maine's Jackie Mundry spoke with Senators Susan Collins and Angus King about the importance of this funding.
Maine, unfortunately, has the distinction of having a suicide rate that is above the national average.
Just a few months ago, the U.S. CDC released a study that showed youth suicide rates are on the rise, particularly in teenage girls. Sheila Nelson with the Maine Department of Health and Human Services spoke to News Center Maine when that study was released. She says this trend actually started before the pandemic.
The trends for youth mental health before COVID weren't great. We'd actually been seeing sort of a little bit of a worsening in young people's reporting of their mental well-being for quite a number of years.
But the pandemic has made this problem worse, which is why Maine senators are working on community-based suicide prevention programs with this $850,000 grant from the federal government.
Part of it is making sure that schools have the tools that they need to do training programs and to help ensure that healthcare providers are better equipped.
Not only is this funding coming to Maine, but Congress passed a bill earlier this year to make 988 the National Suicide Hotline, so people in crisis don't have to remember a 10-digit number in case of an emergency.
It is a very serious problem, and of course, prevention is what it's all about.
Prevention through training, so people who are around teenagers know the signs and can step in if needed. Jackie Mundry, News Center, Maine.